children of all ages, but had a chance to read a book about snow to 3- and 4-year-olds, and was able to talk to them about the majesty of a beautiful snowflakes. We had a lot of fun with the kids just a few moments ago. But why this is so important? When you see children here, that means the parents are able to be at work. And many of the people who work here actually work for the Department of Labor. And so this gives people that opportunity that is denied so many other places. And I'm proud that we have this in the state of New York, but I also want to make sure that this is expanded. So as the first mother of New York, first woman who ever held this position, who has children, who knows the challenges of childcare, the affordability crisis, even finding enough slots. I know what this can do. It kept me from my career many, many years ago when I didn't have any alternatives. And so this is an issue that I feel deeply about, that I want to make sure that all families have access to good, high-quality, affordable child care. And we're looking at statistics that are just very deeply troubling in terms of what those challenges are for young families in particular. So here's what we want to focus on. When I first became governor, I talked about how when we have our businesses who are coming to us, let's find a pathway for particularly new businesses as they're setting up shop, that they can actually start incorporating a child care facility on their premises. I'm really proud that I was able to be there to acknowledge that Migrant, which is bringing 50,000 jobs to upstate New York, is literally right now building an on-site child care center. That is the model that we are looking for. We also know that there are times when we need to make sure that there are incentives for businesses who can't always afford to do this. Some can and some cannot. But the objective is still the same. So I'm proud to announce today over $100 million investing in child care. The first is a $50 million tax credit to incentivize businesses to either create on-site or to pay for a third party to provide the services of child care, whether it's in the vicinity or how they want to manage this. So it's a $50 million tax credit to help increase the supply of child care slots for employees. I think this is going to be helpful for businesses in particular. In a tight labor market, this can be the difference between someone working for one employer or another based on whether or not they have child care available. Our commissioner has said that that's why a lot of DOL workers can be on site here, because of the availability of this great site. So we also want to talk about how it's about building capital buildings. Okay, $50 million we're announcing to build new child care centers and expand those that are already operating. So $50 million in a tax credit to help incentivize businesses to do the right thing. And also, let's start building more facilities and adding more capacity. The projects have to be shovel-ready and operational within 6 months of completing the construction. So all this is a roadmap toward a better future for our families and for their children, and continues on our $7.6 billion investment overall, which we announced 2 years ago, where we capped child care costs. Also, expanding the child care tax credit, which I have pointed out that it was available only for parents with children age 4-year-old and up, not for babies to 4. And I pointed out to our team last year, and I said, but that's some of the most expensive time in a child's life, when they're outgrowing the clothes every 3 months, and you have to buy these expensive formulas that are sometimes in short supply. So I said, let's make it easier on all families here in New York. We're focused on affordability, making life easier, more affordable here in the state of New York, and focusing on our families will give them the resources they need to thrive in our state, and also help our employers be the place people want to work. So just happy to take any on-topic questions while I have our commissioners here about what we're doing today, and otherwise we'll take a couple off.
Let's start with child care on topic.
Okay, that's a little cynical. Come on, you got to care about the kids.
Anything about when you want to look forward, look ahead to next session or next year for childcare?
Continuing these policies, again, a $7.6 billion investment is historic. And part of it is also attracting more workers to become healthcare, or childcare. I keep saying healthcare because we also have a healthcare shortage. Childcare workers. The pay has not been great. We want to make sure that we're upping the income levels so people can also take advantage of our assistance. What I did since I became governor is that families of 4 earning $54,000 or less, which is poverty level, they were the only ones eligible for subsidies. I said we're leaving out a lot of middle income workers, so we increased it so people now earning up to $93,000. Just in 2 years, I made that change. So the higher threshold, we're going to continue that and keep looking at that. as inflation goes up and the costs go up, find other ways we can take the pressure off our families. It's imperative that we do this. This allows us to be a more competitive state, but also allows families to grow and take care of their children, knowing that they're in a safe place like this. That's
Increase wages for childcare.
we're looking at everything. We already have. We've also given out bonuses. We've been very supportive of these individuals. Is there anything else on that space? Okay. All right. All right. Thank you very much. Okay.
Thank you,
All right.
Commissioners.
Okay.
Thank
see
you.
Thank you. Yeah. Okay. All right.
The state controller has a report out today regarding nursing homes and COVID, saying that the state needs to do more to track infectious diseases and hasn't really made up for a decade of underinvestment in the health department. So I guess what I'm wondering is, do you think that we're prepared for another pandemic if it were to hit?
I will tell you, I 100% agree with the controller's assessment that a decade of disinvestment in all facets of healthcare, whether it's Medicaid reimbursements that were flattened for a decade, and I increased them to be 7.5% increase, so we have made investments. We've invested in our healthcare workforce. We gave bonuses to people last year, but also our Department of Health. You know, the agency charged with overseeing our nursing homes was basically starved to death. So I've had to bring in new leadership, infuse more money, try to attract more people to this. So I agree with them that there have been problems in the past. We are laser focused on fixing them, bringing more transparency so the public knows what's going on in our nursing homes, that we have the data that's available to us, is available to the public, and also many other areas we're making improvements. Are we ready for the next pandemic? Is that your question?
Well, I guess it's the bottom line that people worry and wonder about.
A lot of lessons were learned the hard way. We won't make those mistakes. Mistakes that were made in the past will not be made again, I can assure you that. And I'm looking forward to continuing to work closely with my health team to identify areas where we can become not just ready, but be nation leading in our preparedness to deal with any health care effect that comes. But what I'm doing right now is I stopped last year a hiring freeze that had been in effect for a number of years, which stopped us from being able to recruit the top talent. This is what I heard when I brought in my new health commissioner. He says, people are leaving because it's in disarray. People don't want to work here, and we lost a lot of high caliber talent that could help us weather these storms. So we're bringing people back in. We've changed the culture, we've changed the environment, and are very focused on not just healthcare institutions overall, but really laser focused on our nursing homes where we take care of the most vulnerable in our state.
All right, Nick.
Governor, do you plan to have, or have you had any conversations with members of Congress on redistricting?
No.
And I know you've spoken about how, you want to have fair lines, fair maps for New York going forward. Is there a reconciliation needs to take place for your also desire, which I think is fair to say, that you would like to see Democrats take control of the House next year?
My own personal views have to be separate from my role as the governor of the state of New York. The process must play out in an objective way, the way that was set up by the voters of this state. And that's what was thwarted last time around. The voters have said they want an independent redistricting commission. They want that commission to do their job. But there is a fail-safe position that if they're not able to come to a consensus, which is what their job is, and they should do this, then it has to go to the legislature. The voters of New York never said that this should go to a single judge in a small part of our state to make a decision that affects the ability of 20 million New Yorkers to have proper representation. That's my focus on it, not in a political lens, but a lens of making sure that the process is followed, because that's what the voters of New York asked for.
Elise.
Governor, some advocates and lawmakers are calling for an addiction public health emergency, that this could potentially open up doors for funding to combat the opioid crisis. Is this something you would consider?
Let me distinguish between us treating it as an emergency and an emergency declaration, because they're both very different here. One is, we know there's an emergency going on in the state. I lost a member of my own family to this crisis, overdose. I know how deadly fentanyl can be. I know our job is to make sure that more people can get into treatment, that we have more beds available, we have more practitioners in this field. So I chaired for many years as Lieutenant Governor the Heroin Opioid Task Force. Many of our recommendations came through to stop people becoming addicted because of a doctor over-prescribing opiate-based prescription drugs. We narrowed down the length of time that people can receive them. There's a lot more monitoring. So we have treated it as an emergency already. We also allocated and distributed already to date $2.8 billion from settlements. So that is already out there. The idea of an emergency, what an emergency declaration does, it simply allows you to bypass the normal channels for procurement. So yes, it's an emergency. We're focusing on it with a sense of urgency, but nothing at this time dictates that we bypass the normal channels for procurement. I think that's the only distinction. But we view it as an emergency.
Governor, the state set up a portal a few months ago to help migrants apply for jobs. Any update? How is that working? How many applications have gone through that portal? And what's the vision of success?
Let me get you up-to-date information. I did have a meeting, in fact, I think I have a meeting tomorrow on this. So we'll have data, but I do have a dashboard that I look at all the time and see how many people have applied. The first step is the case management. What did not happen early on when the migrants first arrived was a tracking system to identify what countries they're from. Are they applying for asylum? Are they not? Do they have another status? Are they Venezuelans who came in before July 31st? So we have different categories. Where are they located? Who's eligible? Now, I will tell you this. All of the individuals who are eligible who came upstate, working with our partners upstate, every one of them now has applied for work authorization. That is great progress. Now, there's a 30-day window. Now, the federal government wants at least 30 days. I've asked them to shorten that. I've asked them to send more federal employees to expedite that. But I'll give you the exact number tomorrow, but as of last week, 37,000 jobs that are in my portal that we set up. And these are, actually half of them are upstate, where employers are saying, we want these workers. They're not just farm workers. Hotels, restaurants, call centers. We have people all over. They want people who are bilingual. So there is a great opportunity here. So I'll be happy to get you the data. I want it to go faster. I'm impatient, but we're making real progress.
So where's the gap right now with the people who have applied and those businesses that say they'll take them?
And I can have we can have the commissioner come back in and answer that question. There's not a gap, it's just the timing. Not that many have received the actual authorization, but the first step was to find them, get them to apply, and now to match them up. So
there's been a good number that have applied now.
Well, the numbers are going up. I will tell you, again, this is where I can give you more precision if I had it in front of me. Commissioner, 1 second, I'll tell you what the question is. That standing this up, because we only learned in October that we'd be able to have, for example, the expedited TPS for Venezuelans. So we had to identify a location, bring in extra workers, make sure they were trained, and I think we were doing like 3 or 4 a day. It is now over 200. We have a plan to get to over 500 a day very soon. So that's how we're scaling it up. I said we would get data, and if you don't have it off the top of your head, we can get it. There's still about 37,000 jobs for the migrants.
It's closer to 40.
40,000,
Yeah.
okay. I knew updated information.
It's great.
40,000, and we're still working people through the matchmaking, but they have to have their work authorization. But we're having the conversations now, so tell
Right,
if
so
you can
it's
tell them
really
what
exciting, and I just have to say, I thank the governor for giving us this opportunity, and I get really emotional about it, because it's an amazing, amazing thing to do. So these people have come a very long way through a very difficult journey, and they've landed in our state. And the governor went down and lobbied the president, please give us TPS so we can give them work authorizations, and he did it. So they are doing their intake with the federal forms. It all takes a lot of time. They have to have their materials. There have been volunteer lawyers that have been working with them. We've set up, different sites around this. It's mostly New York City. But they are so grateful for the services, and the services really are everything from, we do a very deep dive on what is your background, what's your training, what did you do in your country, what do you want to do you have any certifications, what's your level of education, do you have a driver's license, all those sorts of things. And then we begin, before they actually get the EAD, the emergency work authorization, we can begin to talk about matches. We can't actually match them until they get their actual work authorization, but that work is taking place. We're doing career fairs where they can actually meet the employers. The employers really want to have that one-on-one relationship, so that's very exciting. The best thing is they are now telling their friends who are also coming to meet with us. There was a a hesitancy at first, which you can understand. They left their country because of their government, so they're not going to like leap into the arms of a government they don't know. They've been very, very excited to be greeted in New York this way. We're getting people jobs, but more than that, we're getting them used to being in New York State, used to being in our cities, used to being accepted here, and that is an amazing experience. And many of them want to go to another city in the state. We're connecting all across the state, and we've gotten outreach from the business community, from the retail community, from hospitality, from the AFL-CIO, from healthcare, from your agencies, where the agencies are coming to see who can I hire from this group, because we all need employees. There is a definite lack of workers in New York State, and these are our next wave of immigrants who are going to do that work. So,
Beautiful.
thank you.
I want to understand where I guess we could call it a bottleneck maybe.
Mm-hmm.
How many migrants are in that bottleneck between making the application,
Getting the EAD?
interview, and actually getting the authorization?
The authorizations are just starting to come. The government, the federal government's been wonderful. They've set up sprints to expedite this, but as you can understand, expedited means maybe 2 months. So the work authorizations are coming in. We're developing ways to track those authorizations. It's a huge effort because the city has people, we have people, the feds have people. We're trying to aggregate them all together. It is a bottleneck, but it is beginning to break. And I'll just say, these people are very resourceful, and they've come a long way. They've got a lot of grit. They got to New York City. So as we prepare them for work, they are meeting employers, and they are going to work when they get the authorization. And it is a blessing.
Thank
We've got
you.
time for one more, John.
You've been extraordinary on this. I want to thank you.
Thank
Really,
you.
this is
Thank
what
you.
leadership's all about, how you took this and ran with it, so thank you.
Governor, piggybacking on Nick's question, whether the IRC draws the lines or the legislature draws the lines, they will end up on your desk. So when it gets to that point, how are you going to assess that? How are you going to determine whether or not those lines get your signature? What are you going to be looking for?
Again, to me, this is a pro forma activity by the governor. You do not want the governor to put her thumb on the scale and say, I like that one, I don't like this one. That's not how it was set up. It is a pro forma measure that I expect the process to play out the way it's envisioned, the way it's supposed to by law, and that means the Independent Redistricting Commission does their work. If they don't do it, the legislature does, and then I will sign it. And again, this is where you do not want a governor saying, well, let's see if we can help this person over here a little bit more, and I got a friend. That's not what we're going to do. We didn't do it last time. We're not going to do it this time. So, but happy holidays, everybody. Good seeing you. Thank you.
Donald Trump on the ballot in New York in 2024?
I'll be very intrigued to see whether, similar to Colorado, a group of citizens who are aggrieved want to point out the fact that that their state has been successful. We'll see what the Supreme Court does, but it's not something that we do, but it's something I'd watch very closely because that was one of the darkest days in our nation's history. January 6th will live in infamy, and shame on us if we forget that. Shame on us what happened to this country when a Capitol that I used to proudly walk in as a member of Congress was literally under siege. People died, people were injured, and if he doesn't take responsibility for that, then the American people ought to hold him accountable. So that's what's starting in Colorado. Thank you, everybody.
Mary Adams get indicted on